Hello everyone, my name is Alicia. Welcome and welcome back to my channel. Hope you all are doing well. When I was planning to move to Ireland, I received a few job offers from nursing homes. At that time, I had no idea what a nursing home actually was or what the roles and responsibility of a nurse in a nursing home involves. I searched on Google and YouTube but could not find anything relevant, and that's the main reason why I chose this topic today, because still there are nurses who literally have no clue about nursing homes. I already have a video on my channel about the difference between hospitals and nursing homes. I will link that in the description below. In today's video, I have one of my subscriber with me who has been working in a nursing home as a nurse for the past 2 years. We'll be discussing everything you need to know about working in a nursing home, including roles and responsibilities, pay, overtime, nurse to patient ratio, leaves, and more. So without any further ado, let's get started. Thank you so much, Diksha, for your time. And I hope this video is going to be very helpful for all our subscribers.
Thanks for having me.
So we will start with your nursing qualification and experience back home.
So, when I applied for Ireland, I had just 1.8 years of experience in medical ICU. So, that was in Fortis Hospital, which is 350 bedded hospital. So, yeah.
Yeah, that's actually very good because most of the hospitals or even nursing home in Ireland look for somebody who has experience in 200 plus bedded hospital. Had only 1.8 years of experience और उस experience में आपको Ireland में job मिल गई. That's very good and you got very lucky.
Yeah, I when I came here, I was feeling like, thank God, I just came here with that experience because I have seen people working here having more than 5 years of experience also. So yeah, that was good start.
And what was your OET or IELTS scores?
I did OET, so my score was Ireland score. I got listening as C plus and rest was B.
And as you work in a nursing home now, so I know back in our own country, not everybody is aware what is nursing home and what are the roles and responsibility of a nurse in nursing home. And that's the reason we are doing this video. So how did you find out about the nursing home when you were in India? And how did you end up getting this job?
Actually, I was looking for a hospital job, but as my experience was really less, they was looking for a nurse who was having more than 3 years of experience. So I wasn't able to get in hospital. And then I looked for some nursing homes, and through them, like through an agent, I got this one.
Did you go through with a private agency or a private agent?
Private agent. Yeah, it was from my friend who actually came through that agent. So she told me, like, yeah, this agent is really nice and you can also process through him. So I contacted him. Yes.
Okay, that's good because I always say this to everybody. Don't go with agents who you don't know. So that's
Mhm.
good. Your friend was aware about this agent. And
Mhm.
usually, when we choose a private agency or a private agent, we need to pay a lot of different charges. What was your processing fees for the whole process?
For the agent fees, it was 2.5 lakhs, and rest of the expenses was mine only. So I nearly paid 6 to 7 lakhs. Yes.
So, total it's 6 to 7 lakhs.
Yes.
So, does this include your RCSI aptitude test or did you pay it separately?
It doesn't include my aptitude exam fees, but my aptitude exam fees was paid by my employer. So I was lucky.
Okay, that's good. I know some of the employers, especially private employers, so they kind of make a contract. I don't know. I'm only asking because I want to know whether it was the same in your case. So
Mm-hmm.
they will make a contract in which they mention that they are willing to pay your aptitude test. And
Mm-hmm.
just in case if you fail in aptitude test, you need to return back all the
Yeah, that's right.
amount which they have paid. So that was the same scenario with you.
Yes.
Yeah, that's what I say to everybody. It's very normal. So they will make a contract because they are trusting you and your skills and, of course, your
Mm-hmm.
knowledge. So you need to clear that exam. If you are unable to clear it in one go, you need to return the fees and then you can appear for RCSI exam again, but you have to pay fees from your side, isn't it?
Yeah, that's right.
And so how long was your process, the whole process?
So it Took nearly 6 to 7 months altogether for me to reach here.
Okay, that's not bad. 6 to 7 months is usually when even you are going through a government agency and you are getting selected into HSC hospital. So it's the same, like 6 to 8 months.
Okay.
And talking about your interview, so how was your interview and what type of question do they usually ask in nursing home interviews?
So interview was okay. It wasn't that bad, and they just asked few general questions only. So I was okay with that. Yes. So it lasted for 20 to 25 minutes, and that they just asked me about me, myself, and which area I worked, and few questions related to nursing. That's all.
Yeah, I think I have seen most of the private nursing home. They just want to know where all you have worked and what's your basic roles and responsibilities. So I think that was the scenario with you.
Hmm.
Okay, so that was about your interview. So talking about your RCSI aptitude test, which is the major hurdle in the whole process. So did you take any coaching for RCSI exam and how was it? How was your experience?
I didn't take any coaching, but I studied with my friends. They help a lot, and I studied from RCSI website, which where they provide lots of study material. And also, when once my friends came here, I contacted them and asked like, what are the things they have asked you, so which helped me to prepare well.
Okay, that's very good. And how would you rate the difficulty level of RCSI test?
It's 10 out of 10. It was so difficult. Yes, it's just because we are nervous and it's completely a new thing for us. So that's why I think I would say it was difficult.
Yeah, so it is a difficult exam, of course, because you are in completely different country and your examiner is belongs to different nationality. So it's difficult, and at the same time, your anxiety level will be too high when you're preparing for this exam. And I have actually two very dedicated videos about aptitude, RCSI aptitude exam on my channel. So if you are somebody looking forward to know what is RCSI aptitude exam, you can watch those videos. I will put the links in the description of this video. So that was all about your nursing experience, nursing qualification, and how did you end up getting a job in Ireland. Now we will move to your roles and responsibility as a nurse working in a nursing home. So सबसे पहले तो obviously there are two types of nursing home in Ireland, as most of us know that there is private nursing home and HSC nursing home. So आप कौन से nursing home में job करते हो?
ये प्राइवेट नर्सिंग होम है.
And what's your total working hours?
It is 37.5 hours in a week. Yes.
Okay, so it's same like in HSC nursing home or in HSC hospital, so it's 37.5 per week. So here comes the important part about the video. Roles and responsibility working as a nurse in a nursing home, because back in India or back in any other countries जहाँ पे nursing home नहीं होते हैं, वहाँ पे candidates को actually पता ही नहीं होता कि nursing home क्या होता है. And कुछ लोगों को ये भी लगता है कि nursing home is completely something different like a old age home or something like that. So अब हमें दीक्षा ये क्लैरिफाई करेंगी यहाँ पे कि नर्सिंग होम में एक्चुअली नर्स की रोल्स एंड रिस्पॉन्सिबिलिटीज क्या होती है, बिकॉज मोस्ट ऑफ द नर्सेज बैक होम दे थिंक दैट नर्स इन नर्सिंग होम इज like they don't work as a nurse. So Diksha, can you tell us what is the main role and responsibility working as a nurse in a nursing home? And first we will talk about day shift.
नर्सिंग होम जो है एक मतलब सेटअप होता है जहाँ पे मोस्टली ओल्ड एज पीपल्स ही होते हैं और उसमें मोस्टली डिमेंशिया वाले केसेस होते हैं कि जिनको लाइक फॉरगेटिंग की प्रॉब्लम होती है. तो हमारा जो नर्सिंग होम है वो 29 बेडेड है. एंड तो डे शिफ्ट स्टार्ट करने के लिए लाइक वी टेक द हैंड ओवर फ्रॉम द नाइट नर्स एंड चेक द our the TDA, and with then communicating whatever the issues was there in the night shifts, and then giving the medications in the morning, and then check all the resident are they fine or not. And then if there is any admission, letting know the healthcare assistant about that, and preparing the bed, taking the handover, giving the medications, making sure that everyone is fine. If there is any issues, just contacting the GPs and communicating that to the next of kin.
So ये जो आपने roles and responsibility बताई, this is for morning shift. And what's the nurse patient ratio in nursing home?
हमारा नर्सिंग होम जो 29 बेडेड है तो एक नर्स होती है मोस्टली, बट अगर 2 नर्सेस हैं तो इट्स गुड, लाइक मोस्टली 1 नर्स, एक नर्स ही देख रही होती है पेशेंट को।
Okay, so it's kind of 1:29.
1:29, हाँ, ऐसे बोल सकते हैं।
Yeah, so everybody who is watching the video, अगर आपको नहीं पता है, so you might think 1:29 is quite a lot, which is, I agree, quite a lot. But nursing home में आप hospital की तरह आपको कोई emergency से deal नहीं करना, isn't it? You don't have any emergency situations there. I think it's very rare if you have any emergency situation.
Yes, it's very rare. Once it is there, then we have to manage it, but usually it's fine. Like,
And one more thing, so patient in nursing home, so they are not called patients, they are called residents.
yes, that's right. They're not patients, they're residents.
सो दे आर नॉट पेशेंट, सो इसलिए वहां पे 1:29 का रेशियो बहुत ही नॉर्मल माना जाता है, बिकॉज दे आर
Mm.
लाइक नॉर्मल रेसिडेंट लिविंग इन नर्सिंग होम, बट ऑफ कोर्स दे नीड प्रॉपर केयर. नाउ टॉकिंग अबाउट केयर, who take care of their personal hygiene needs? So do you have enough carer on floor, or is it carer and nurses together taking care of the patient?
So एक शिफ्ट में 4 हेल्थ केयर असिस्टेंट होते हैं और उसमें कभी कभी नर्स भी होती है, सो इट्स जस्ट अ मिक्सचर ऑफ बोथ नर्सेस एंड हेल्थ केयर असिस्टेंट. एज आई सेड, मोस्ट ऑफ द पेशेंट्स आर एल्डरली, तो हमें उनकी हाइजीन नीड्स मेंटेन करनी होती है अर्ली मॉर्निंग में, एंड डिपेंड्स ऑन देयर level of mobility. Some are very good in doing their own, hygiene needs, but some needs assistance or some just need directions. So it totally depends on them.
You don't have any doctor on floor, so there is no 24/7 doctor on floor or doctors round, nothing like that.
नहीं, डॉक्टर्स नहीं होते. उनके पेशेंट जो भी रेजिडेंट्स हैं उनके खुद के जीपीस होते हैं. So in case of any emergency or illness, we contact their GPs. And if the GPs are not available, suppose in weekends or like after 5 o'clock, so we contact out of hours GP surgery.
Okay, so that's good. And so that was day shift. Now talking about night shift. So what is the roles and responsibility of a nurse during night shift?
नाइट शिफ्ट में जब नर्स आती है, सो वी टेक हैंड ओवर. देन उसके बाद नाइट मेडिकेशंस देते हैं वो रेजिडेंट्स को. उसके बाद मतलब उनको बीच बीच में चेक करना होता है कि आर दे स्लीपिंग ऑल राइट, सब सेफ है. सेफ्टी इज द मेन थिंग दे लुक. वो उनको बीच बीच में चेक करना होता है कि वो ठीक ठाक हैं. और कुछ पेशेंट रेजिडेंट्स होते हैं जिनको मतलब रिपोजिशन करना होता है, सो रिपोजिशनिंग वगैरह करते हैं. So, in case of any emergency, we contact the next of kin and get their confirmation either they want to send resident to the hospital or not, because they are elderly. So, some like family doesn't want them to go through a lot of the hospital transfers and all. And if yes, then we proceed with ambulance. And in the morning handover rounds, we just inform our senior person also, like CNMs.
And what about carers? Do you have carers even in night shift? And then how many carers?
So at night time, we have 2 carers and 1 nurse, because mostly every resident is in the bed, so they just have to go through everyone and make sure that they're safe and maintaining their hygiene needs. Sometimes it really gets busy and we don't get time to take the breaks also. Usually it happens during the daytime when it's busy, like we're just up the walls.
Okay, yeah, I've heard that nursing home can be really, really busy, but to be honest, trust me, even hospitals are very, very busy here. Another thing I was thinking, so what if a patient fall during daytime or night shift? Do you have like extra help in nursing home? मतलब आपके पास CNMs होते हैं वहाँ पे या कोई और होता है who can look after your work or who can look after the patient? So how do you manage such type of incidents?
So अगर कोई resident fall होता है, तो obviously we just go and check them and take their vital sign and make sure that they're safe. If we feel like there is a chance of any fracture or anything, then we send them to the hospital for a review. And we have our CNM working there, so she helps us with the writing the incident and informing the next of kin. And we just go on the floor and look after the resident.
Okay, so that was about roles and responsibility. Now talking about salary. So what's the salary in nursing home? Is it same like INMO scale or different from that?
My nursing home is a private nursing home, so they don't follow INMO scale. And I got the pay scale whatever was promised me during the offer of the contract.
So you have your own contracted amount, and do you get yearly increments or is it the same for 2 years of contract?
Usually they mention in the contract like, okay, so this will be your salary for an year, and then you will get this much. So they give the amount whatever is promised. So there is an increment on yearly basis.
Okay, so that's good, at least something.
Yes.
So salary wise, you don't get INMO scale. And what about overtime? Like, do you get to do overtimes or not?
We get a chance to do overtime, but it's the same pay.
Okay, so you don't get any extra pay because usually if you do overtime, so you get time and a half. Like you don't get the same pay.
Mm,
It's like that in HSC and private hospitals, but you get the same pay if you're doing overtime.
yes, we get the same pay.
And by same pay, I think you mean here is the same hourly rate which you get if you're working in your normal days. So that's
Yeah,
what you mean.
yeah, that's right.
Okay.
Mm.
And what about premium night pay? So if you're doing night shift, is there any extra pay or it's the same pay?
It's the same rate which we have in the days and then in the nights. Yeah.
Okay. And do you get extra pay working on bank holidays and Sundays?
Luckily, yes, we do get. So Sundays is one and half of the rate we are on, and then for the bank holidays, it's double if we are working. And if we are off, then also we get some amount of that. I think that's the 1/7 of the rate we are on.
Okay. So at least something.
Something. Yeah.
But usually, if you are working in HSC hospital or in private hospitals or even in some of the private nursing home, I think people do get premium night pay. And by premium night pay, I mean you get extra money if you're doing night shifts. That's why a lot of nurses prefer doing night shifts because of extra pay. But I think that might be just your nursing home policy or protocol, or not sure what it is. But usually, I've heard that people do get premium night pay in all the nursing home. Okay. And what
Mm.
about leaves? So, how
We
many weeks of, I know it's very difficult to calculate leaves here, but just approximately how many weeks of leaves you get, like annual leaves, how many weeks you get?
we get 4 weeks of annual paid leaves in a year.
Okay.
Hmm.
And do you get any sick leave in first year of your work?
Yes, we usually get sick leaves, and if we want to get it reimbursed, then we have to get a certificate from the GPs.
So that's called certified sick leave. So you get certified sick leave, but you don't get uncertified sick leave. So if you're not providing a sick certificate from your GP, that will not
Mhm.
be paid.
Yeah, that's right.
So, like for yourself, you have finished your contract. So, do you still need to get certified sick leave all the time, or do you have some uncertified sick leaves in your kitty as well?
There is no difference. Either I have completed my contract or not. It's just the same way it works.
So, I think you don't have any uncertified sick leave. So, uncertified sick leaves are the one which you can just take whenever you are sick. You ring the nursing home and you say, I'm sick. So, I think that's not the case for you. So, every time if you want a sick leave, you need to give GP certificate to make your sick leave paid. Is that correct?
Yes, that's right. We get sick leaves, but if we want to get a paid sick leave, we have to contact GP or provide a medical certificate. So only we will get the paid sick leave. Otherwise, it will be unpaid sick leave.
Okay, so that means you don't have any uncertified sick leaves. It all has to be certified.
Yeah, that's right.
And also, I actually forgot to ask you. So when you came in here, तो आपका जो
Mhm.
contract था वो 2 years का था because usually it's 2 years.
Yes, my contract was of 2 years, and I finished my contract recently.
Oh, very good. So you applied for stamp 4 because everyone who is watching this video. So if you are working on critical skills permit for 21 months, you are eligible to apply for PR. So have you applied for your PR, Diksha?
Yes, I did, and I got.
Okay, congratulations. So now you have received your stamp for, you're a PR holder and you have finished your contract. So do you think you'll have any kind of promotion in nursing home if you work there for long, or any kind of further opportunity, or any kind of sponsorship which they provide so you can study further? Is there anything like that in a private nursing home setup?
I am not sure about other nursing home, but in our nursing home, they did offer myself a senior position like a CNM position, CNM1. According to me, promotions are very less in a nursing home if we compare that with hospital. And they usually don't offer any kind of further study courses if you want to study that we can take by ourselves.
Okay, fair enough. Yeah. So I think most of the HSC hospital will sponsor you for further courses. Private hospital also do sponsor you, but they have very limited seats. But I think HSC hospital sponsor you most. Okay, so that's all, Diksha. Thank you so much. And before we finish our video, I have one last question. So, what suggestion or advice you would like to give nursing candidates who wants to come to Ireland and who wants to work in a nursing home? Now you're already here from last 2 years. तो आपके experience के according आप उनको क्या advice करना चाहोगे?
According to me, it will be good if you go and work in a hospital actually, because nursing home has very limited growth opportunities comparing to hospitals. And it will be good if you get a good experience in your own home country in an hospital where you get exposed to different cases and you know how to manage them. And once you come here, it's good if you start with a nursing home also, because you will get to know how you have to deal with the families and what are the things you can come across. But if you have a bigger picture or bigger plans, then obviously I would say like hospital is a better place to work.
Well said, Diksha. I completely agree to whatever you said. And if you have a bigger plan in your mind and if you want to study further, even starting in a nursing home is not bad, but always try to start somewhere where you can build your base. So thank you so much, Diksha, for your time and patience. And I hope everybody who is watching this video now they know what are the roles and responsibility of a nurse in a nursing home. Thank you so much, Diksha, again.
Thanks for having me on this channel, and I wish all the best for all the nurses who's looking for moving to Ireland.
That's all for today's video. I hope this information was helpful for those of you who are planning to work in a nursing home or are simply interested in learning more about what it's like. If you still have any questions or if there's any topic you would like me to cover in my future videos, please feel free to leave a comment down below. Also, if you find my videos helpful and if you like what I'm doing, please don't forget to like, share, and comment on this video. For you, it will just take a minute, but for me, it will give me encouragement to make more content like this. Also, hit the bell icon so you don't miss any of my upcoming videos. Thank you so much for watching. I'll see you in my next video. Bye bye. Take care of yourself and your family.